Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkofer and I work for the Neurologic Wellness Institute here in downtown Chicago. And today's episode is going to be kind of a fun one. And the question is, how do babies show us ideal posture? And so posture is a big term in manipulative therapy, in manual medicine. And so chiropractors, PTs, osteopathic doctors all look at posture. And we try to examine posture to see where we could have missing links, we could have imbalances in our muscular system, in our skeletal system, or even our brain and our nervous system. And posture is one of those things that it should be all based on locomotion. And if we look at babies, if we look at how a baby develops to develop posture, we can see what ideal posture should look like in adults. And so I'm going to talk about one article, a brand new article in 2020 from people that work at or work for and practice Dynamic Neuromuscular Stabilization, that's DNS. It was initially started by people in the Czech Republic. Pavel Kolar is the main guy behind it, and it's all based on developmental kinesiology. Basically, how babies develop, how we move in order to create a postural stability system. And so I want to get into the article and kind of show this, and there'll be a lot of cool pictures of babies and how babies move correctly, and then comparing it to how adults and how we should be sitting, stabilizing in different postures. And I believe this is really important because most of us out there exercise in some way, and or are sitting for jobs or standing and walking for jobs, and we're going to be in a variety of these postures during our exercise or during our sitting at our job, and this can all lead to imbalances, poor stabilization, and therefore pain or other outcomes that are detrimental to our health and our body. So let's get right into this paper here. So this is from the Journal of Bodywork and Movement Therapies from 2020 again. And so the title is Functional Postural Stabilization Tests according to Dynamic Neuromuscular Stabilization Approach. It's by a bunch of people that all work for DNS, and Pavel Kolar is one of the main guys that started it, and so out of the Czech Republic. And so first of all, this is mostly for clinicians, so they're looking at different tests in order to test posture in adults, and then these tests can then be utilized as an audit for therapies in order to look at not only are we making improvements in posture, but then which therapies should be used for these. And so we're going to go just to a couple different pieces here, and then we'll go back and look at all the photos. And so here, a short essay on posture and movement, published 40 years ago, J.P. Martin, says that posture basically is a fundamental human function that typically requires minimal conscious awareness. So we should be able to sit upright at our desk, type on the computer, no problem, minimal conscious awareness. It addresses physical forces, basically we're defeating gravity to have good posture, and principles of mechanics, and also the need for voluntary movement. So basically, it should be relatively minimally conscious. We have maybe some voluntary movement, but then we should be able to then move our arms and legs around that. Let's go to another part of the paper here. So postural control is directly related to core stabilization. Core is a big term in manual therapy now. Core, a lot of people think of core as maybe just the abdominal muscles, the ones that kind of give a six-pack, but your core is really everything that creates a core in the center of your body. And so that is not only the abdominals, but then the transverse abdominis going this way, the obliques that run in either direction this way, and then also the diaphragm, which is just underneath the rib cage, the pelvic floor, which is going to support obviously the pelvis and a lot of organs underneath there, and also the small muscles in the back. So it creates this complete 360-degree core around your abdominal or around your abdomen. and pelvic area. And so there are 5 different components to testing core stability, like strength, endurance, flexibility, motor control, and function. And so overall, you can test core stability in multiple ways, and DNS does it in a different way, and that's based on posture. So here we have developmental kinesiology aspects. So one strategy to define optimal posture is based on developmental kinesiology. So postural ontogenesis, basically this means that we develop posture as we age from 2 to 3 months all the way until we're walking and moving more like an adult at about 2 years old. So postural ontogenesis defines the maturation of body posture with the primary goal of being the establishment of efficient human locomotion. So when we are a baby, when we look at a baby that's 2 months old, they're kind of like a blob. They can't really move. They can respond based on facial structure and facial tone, but then and facial expression. Sorry, that's the word I was looking for. Facial expression, but not really moving. And if they want something, they cry. If they might be able to look at something next to them, but eventually what happens is they can be able to roll over and reach for something to their side. And then from rolling over, they can maybe sit upright on their side, and then sit upright and reach and play with a toy. And then eventually they get to the point where they can be on their stomach and crawling, on their hands and knees and crawling to actually move, and then eventually to walking. And this process all happens because the baby wants to move. The baby wants to be involved in its environment. And so I just think that this is the best way to look at posture, because this is how posture develops. Another quote, so postural development occurs from proximal to distal. So basically it starts at the core. It starts, that's that word again, it starts in the midline of the body. And it starts with not necessarily the extremities like the shoulders and the elbows. It starts deeper within the spine and the torso, and eventually moves to the distal joints of the extremities to then be able to use our hands and fingers, our opposable thumbs to read and write. This progression occurs due to maturation and learning by the baby. The problem is that over time, we have this movement regression, which slowly evolves in a distal to proximal direction. This regression occurs as we gravitate toward other skills, movements, and habits. So when we start sitting a lot and we're sitting with backs on our chairs and sitting back right up, we're not sitting upright, that leads to poor postural stability. It leads to this movement regression. When we start writing, we're only writing with one hand, it leads to kind of this distal regression on the left side. Or if we're a tennis player or a baseball player, always moving in one direction, rotating, then that can lead to changes as well. And so what DNS does is it's this neurophysiological, developmentally based rehab approach that utilizes functional tests to qualitatively assess postural control. And then we put people in different movement patterns based on developmental kinesiology to improve things like over here, reducing back pain, improving quality of sensory perception, treating cervical instability and neck pain, improving balance, gait, stance, core stability, and neurological disorders like cerebral palsy. That's where a lot of this developmental kinesiology work started, was in kids with cerebral palsy. And so down here then, they have a list of a bunch of tests. Let's go all the way just to this one. Okay, so we're going to go through all these tests very briefly by just looking at the pictures of the babies, looking at how adults may do it poorly and then adults may do it properly. So first couple are breathing stereotype tests, so seated, looking at just assessing breathing. Then looking at intra-abdominal pressure regulation. This is basically to hold pressure within the abdomen, and therefore that allows for some core stability. And this is separate from breathing. The diaphragm underneath the rib cage is important for postural control and breathing. But first is breathing, then postural control, and then it also does a function to prevent GERD, prevent acid reflux. So we'll look at intra-abdominal pressure, we'll look at the diaphragm test, specifically seeing if the diaphragm can expand in all directions, a hip flexion test, a supine test, so laying down on their back, legs raised up, a trunk and neck flexion test, and then an arm lifting, a trunk extension, so laying on your stomach with extension, quadruped, so hands and knees, a bear position, so hands and feet, and then lastly a squat. So let's go all the way up and let's just talk real briefly about all of these. And this is just all the awesome pictures that I love in this paper. So here is just assessing breathing. And so a baby should be able to sit and breathe into his belly without breathing into the upper chest. You should have good expansion of all the abdominal muscles, the abdominal wall from the back to the front, with like this slight rib expansion as well. And if we look at this in an adult, it would look like this, nice and full on the outside, and all the way around, just nice and easy breathing into the belly. The belly button should go out and come back. A lot of times what we see that's pathological is people are breathing up into their shoulders and chest, and you have these big concavities in the neck. The chest is bigger than the abdomen here because they're not actually using the diaphragm that's under the rib cage. Instead, they're using these accessory muscles of respiration to breathe. We want to instead breathe into our belly. And so that's just one way to assess proper posture there. Then the next one is the IntraAbdominal Pressure test. And so that's looking so that as the baby, this starts generally at 3 months laying down, but if the baby's sitting here at like 9 months, then he should be able to hold upright posture with good intra-abdominal pressure, not sucking in to create pressure, but being able to use that diaphragm to push the abdominal wall down, push the organs down, and therefore the abdominal wall goes out and eccentrically holds. And if we look at how this looks in somebody that does it right, again, nice square all the way around, belly is out, and the pressure is maintained while breathing occurs. And so sometimes if we don't see that, pressure is obtained, there's squeezing of abs, we're very tight in our abdominal wall, but breathing occurs up here. And we don't want that. That's a pathological stereotype. Then we have the more diaphragm test. The diaphragm test is looking at, again, postural function. And so we want to make sure the diaphragm doesn't only expand so the belly goes out and in, but so the diaphragm expands so then the outer wall of the abdomen goes out and the back also gets pushed out. And so we're looking at nice and full, a nice full back, no really concavities or areas there. This is kind of what it looks like. Again, we're looking at this posterior wall to go out versus what happens if it doesn't happen right. Again, we're breathing up into the top and the abdominal wall is actually getting sucked in, which is the opposite of what we want in order to properly breathe and use this diaphragm underneath the rib cage. Next one is, so this is a funny one. So next one is just the seated leg or the hip flexion test. So here the baby is sitting perfectly upright, straight, has a full abdominal wall. The only reason there's creases is because he's lifting his left leg into hip flexion. And this should happen because you have a good stability, good support here, and the psoas muscle and other muscles help to pull this hip up. And so if we're looking at the test, again, the patient should be able to properly stabilize here and lift up one leg without moving or hinging off to a side. What happens a lot is we see this, where again, you have these concavities in here by the back. And as we lift, like you say, his right leg up, the whole spine shifts to the other side. This is him trying to create extra support versus the support should already be maintained in there. Next one. So this is this is what happens at about 3 months. So a baby just laying there, able to have his legs up, his or her legs up, knees up, and be able to create this beautiful round belly that has intra-abdominal pressure, has that pressure to stabilize so that the legs can move freely, the arms can move side to side freely. And so this is a supine test with the legs up. How this should look in the adult is the same thing, right? A nice full belly, legs up, nice and relaxed, no problem. we shouldn't see this. We shouldn't see these concavities coming down, trying to use maybe the low back. So the low back is coming off, the ribs are flaring. We're not, and then obviously breathing is happening into the chest versus into the belly. And when the back comes up, it's really hard for the patient to hold the legs up, so they kind of start falling down. So I'm kind of rushing through these. I want to get through all of them, but I just think it's really cool how we can look at how babies look and then compare it to how we should look in ideal posture for an adult. So here the baby is flexing his upper back and neck. Again, look at this. We have this beautiful belly, but then we don't have a lot of muscle showing. And yes, babies don't have a lot of musculature. They do have more fat around it, so it's hard to see exactly. But we don't have any protrusion of the neck. It's just this beautifully just flexion, segmental stability of the spine. What it would look like in the adult, the same thing here. A nice straight spine, no protrusion of the neck, and just lifting it through or flexing through these regions of the upper neck. If we see it poorly, again we get this, this poor stability in the abdomen, and then protrusion of the neck out. Try to lift. This is not as efficient and it's not functional. I'm skipping one here. Maybe not. So this is a process of verticalization. So they must have skipped a picture here, but the process of verticalization, where we actually have our feet and then one hand up on an object like a chair or an ottoman. Yeah, there's definitely something there. Okay. Oh, so I know. It was for the arm flexion test. So basically, generally laying down, if a baby's going to reach above his head, nothing is going to move with that. The baby should be able to move distally without any proximal issue. And so here we're just looking at that. So the arm should be able to go back with the back staying flat, a nice solid abdomen. We shouldn't have this arching or any picking up of the neck because of tight lats or tight muscles in there. This is the extension test, so almost like the swimmer. And so here, baby's able to still create some stability using the buttocks or the glutes to lift up, and then also the upper part of the neck. Again, if we look at how this looks in the adult, we have this retraction and this good stability of all the neck muscles. We are not seeing like this protrusion and this hyperextension in like paraspinals in the back. If we're looking at the hands and knees support, love this picture. Hands and knee support, the hands should be underneath the shoulders. We should have a straight spine. Again, look at that beautiful abdomen. And the baby should be able to support his head and neck and then move it freely. And so here is what it would look like in the adult. Again, exactly what we're looking at versus the opposite, where we have poor scapular stability or instability and this arching of the back. This is not necessarily what we want there. In bear, so bear is like a form of crawling. That's where the hands are supported. Again, are the hands and the feet. And so we should have, again, a straight spine. And the baby's able to move freely with, again, everything the same. In the adult, it looks just like this. Straight spine, chin retraction, head down. Everything is neutral, loading the hands properly. Versus over here, we have either a rounded back. The hands might be loaded more on the outsides. Feet may not be stable, or here the opposite. So instead of a rounded back, we have more of a collapsed spine. And then the neck is kind of in protrusion there again. And I'm pretty sure lastly, we have the squat test. So again, when a baby squats, he's going to reach down. He or she is going to reach down to pick up something. So neck is generally looking down. We have that chin retracted. The spine is straight. Knees are over the second toe. So it should look beautifully like this. Again, head looking down, not up as we're commonly taught. Versus here, if we don't have that, we're squeezing more into our back and we're not able to support are back well. So, sorry that may have took longer than I thought, but I hope you got a good image of kind of like why we should be looking at babies to see why or see how ideal posture should look. That's because posture is all based on movement, and as babies, we are not able to move as babies. Cows, when they get birth, they're able to stand up and walk right away. We instead have to learn how to control our posture and our movement in order to then be able to walk, because that is what we want. And human locomotion, being able to walk on 2 feet, is something that not many animals or mammals can do. And so being able to do that requires a lot of stability and control. And we were able to do that through this postural stability system. So hope this was a good one for people, or at least a little interesting. Please leave your comments or questions below. If you have any suggestions for future topics, I would love to hear them as well. Thanks again. Have a great day and stay healthy.